Good afternoon, good morning, depending on where you are today tuning in. We want to welcome everyone to today's webinar on Leading Through Change. As you know, state, local, and tribal TANF programs face unprecedented challenges in serving families with low incomes. This webinar includes a panel of three extremely dynamic leaders who have been leaning in during turbulent times to create stronger, more resilient TANF programs that are responsive to the changing environment. I'm so excited to hear from them today. These leaders are also a part of our Project Improve family. As a project officer for Project Improve, I want to thank them and you for coming today to share ideas about how we can all make simple changes in our programs that improve lives. I'll now turn over to Michelle Dare of Adjacent Possible on the Project Improve team to introduce the session and the panelists. Michelle?
Thanks, Damon, and welcome everybody. Before I begin, I know I'm going to forget these announcements, so I want to just get them out of the way. We have a great webinar planned for next month under Project Improve. It's called Building Resilience and Reducing Trauma in TANF and Workforce Program Leaders and Staff. We have a great panel for next month. People from the Center on Child Wellbeing and Trauma, our DTA, Department of Transitional Assistance in Massachusetts folks, and then also the Corporation for Skilled Workforce, Vicki Coates from there. So put that on your calendars. There's going to be another announcement to come out, but just make sure that it's in your calendar. And then also in the fall, we're going to be starting an Improved Leadership Initiative. And we'll be kicking that off in September with just an information session. And then the sessions that follow, this whole initiative will follow in the fall. And we really just want you guys to, have the support you need and join the initiative. So it's going to be an open, a great event and a great kind of community for you all to join. So that's the perfect segue, and what we're going to talk about today, and that is really focusing on leading through change. And I just want to take a couple minutes and set the stage for this webinar, because it's really important. I think, as I go across the country, before the pandemic, I've studied TANF and workforce programs for 25 years, over 25 years, clearly back even into AFDC. And we are really at a challenging time. And I think that challenging time was coming before the pandemic, but I think that the pandemic really, really revealed some important opportunities for change and some challenges in TANF and workforce, TANF programs in particular. And these past 2 years have been really, two and a half years have been really hard. And it has challenged leaders and staff and families in ways that have been very difficult. And yet it still creates this pivotal time to self-reflect and to figure out a path forward. So where are we now? Well, the labor market is rapidly changing. Who knows what is happening with that? This hybrid workforce and really trying to get a pulse on that. It's been an ever-evolving challenge. Work requirements are now coming back in. I hear states and localities talk about, and tribal programs talk about, how do we meet these new work requirements as they're becoming reinstated, and we're starting to get used to this kind of new normal. There's what services do we provide virtually, and what do we provide in person, and how do we really accommodate create the flexibility that our workforce needs, at the TANF workforce needs. And then programs are having really, really meaningful but hard conversations about diversity, equity, and inclusion. So what are some of the challenges facing these leaders and others that were on this call today and out there that will listen to this afterward? Really, as we start to create and create this new normal, re-engaging participants that have been really not engaged for about 2.5 years, and trying to figure out how do staff engage participants in ways that are meaningful to them. We're also hearing a lot about mental health conditions, substance use disorders, and fears around going to work, that staff just feel at a loss of knowing what to do and how to really engage people when they feel themselves like they're overwhelmed in their situations. You know, at the same time, I call leaders and staff the emotional first responders, especially staff. I was on a call this morning with a team of Michigan folks in Michigan who are struggling to figure out, how do I engage people that are really, really struggling, that are on a very basic level and are struggling with mental health conditions, substance use disorders, people who are in their family members who have been incarcerated. And yet these workers are often one paycheck away from being on the other side of the table. Staff mental health, burnout, turnover, all of these things. And these conversations around DEI are so important, but sometimes they're super awkward and people are afraid. People are afraid. And my fear is that these conversations stop because of that. And at the same time, you know, we're seeing a ton of resilience, and I've talked a lot about that. And that's the purpose of this webinar, is to come together and share new ideas and build resilience in the workforce and among participants, and really come together and lean on each other in this process. It was funny because even before this webinar started, you know, Lori and Marcy were connecting and saying, sharing ideas, and this is what this webinar is intended to do, to spark new and creative ideas that we've captured. And we've captured some of those in some of the Project Improve and Spark briefs recently. Things like people are using peer-to-peer support groups. People are holding listening sessions with participants, and even co-designing new services with participants, as one of our improved sites did. Using technology to streamline services and programs, and just getting rid of the unnecessary paperwork. Providing mental health services to staff and to participants. As part of Project Improve, we had mindfulness sessions every week through the first year of the pandemic to help support you. So the question right now is, how do we come together and build a community of leaders, particularly among leaders of color, who individually can feel isolated in their own struggles, but collectively can feel bold, innovative, empowered, and evidence-driven. So with that, I want to introduce our panelists, who are everything that I just said and more. We have first Lori Briggs, and I failed to, if you could slide advance, so before I announce our panelists, let me slide back to the objectives of our session. Just one slide back. So to introduce yourselves, I always create slides, but I always talk through them. Again, to just introduce leading through change and new ideas and strategies for doing that, to connect you guys who are struggling with common challenges, and particularly around re-engaging participants, and then learn about this new normal. So next slide. Now our panelists, Lori Briggs, who is a bold and fearless leader. When I met Lori, probably it's about a year ago, she knew very little about TANF, and yet now she's probably among the nation's finest in terms of leaders. She is undertaking a massive overhaul of the Louisiana TANF program, and doing it with an amount of energy, passion, vision, and persistence that is absolutely unwavering. She can introduce her title. It's on the screen. I want to introduce who she is to the people who work with her and know her. Then we have Patricia Blumenauer, who boldly, again, before the pandemic, partnered with Mathematica to do a complete redesign of Philadelphia's program. Now, I saw the before and after, and if you could even imagine and see for a glimpse of what Patricia led through that. It was a three-year-long endeavor, and it was everything all the way through the program to make it more client-centered and evidence-driven. So she'll share some of her experiences, and it positioned them well through the pandemic. And then we have Marcy Littlejohn. I recently met Marcy probably 6 months ago, and she's kind of one of those leaders that you just connect with right away. She's passionate, she's funny, she's smart, and she's very creative in her work. She's coming to us from Franklin County Department of Job and Family Services, where they have a combined TANF and workforce youth program called CCMEP. So without further ado, I just want to quickly announce, thank the panelists for being here, and quickly announce the format of this. I'm going to stop talking and I'm going to ask questions. That's what I actually do best, is just ask questions. And we're going to hear from these leaders. We're also going to hear, if you want to put a comment in the chat or in the question and the answer, please do that. We've got Akash, my partner on Project Improve team, who's going to field this and share what you write, and also gather your questions, and we'll share those with the panelists. So without further ado, I'm going to kick it over to our panelists. And if we could stop sharing the screen, stop sharing the slides, that would be great. We can come back to the QR code on that. And what I'd love to do is just allow each one of the panelists to introduce who they are as leaders and share a little bit more about their programs. So Lori, you want to kick us off?
Good morning, good afternoon. I'm Lori Briggs, and I am the Deputy Assistant Secretary over Workforce and TANF Policy and Programmatic work in Louisiana. I'm always proud to say that I'm a 33-year state of Louisiana employee. I spent some time in the Department of Corrections, most of my time with the Department of Children and Family Services and Child Welfare. In every level you can work in child welfare. I've been an area director in child support enforcement, and now I'm working in the state office programs that I just mentioned. My agency is one that is trying to do really difficult work in a very difficult place to do that work. And what we're trying to do in the creation of a workforce section that includes both TANF, SNAP E&T, and a newly created child support enforcement employment and training program is develop a real career pathway for the poor in Louisiana in a way that has been very difficult for us to even imagine in the past.
Patricia.
Hi, everyone. I'm Patricia Blumenauer, the VP of Operations and Data at Philadelphia Works. We're the Workforce Development Board for the City of Philadelphia. My team oversees all of the programmatic pieces and investments for the workforce and TANF dollars. So we've got adult and youth, TANF and WIOA, and then a bunch of other discretionary funds and grants that have come through in the last couple of years. My background is in behavioral health and mental health. I came to workforce in TANF about 6 years ago, was able to kind of that lens with me. And as Michelle mentioned, we undertook a huge project that I would say is still ongoing every day, that momentum going, and I'm looking forward to talking with you all more today.
And Marcy.
Hello, everyone. My name is Marcy Littlejohn, and I am with Franklin County Job and Family Services in Columbus, Ohio. And our program throughout the state has been coined as CCMEP. However, our youth did not think that was cool enough, and so we relabeled it as AMP, which is Achieve More and Prosper. And we have had the privilege of aligning both our job and family services with our workforce development boards to create a program for our youth that are in this space. To Lori and Patricia, support Lori and Patricia, this is a very different space because the way that work looks for us does not look how it is for the youth that we are in. Prior to becoming a member of Job and Family Services, I've been here for 5 years, just had my anniversary in July. I was in adult education, and essentially in that space, I taught people medical insurance billing and coding and helped them to understand, like, an education is something someone can never take away, and then once you get a career, you're unstoppable. So I'm very excited to be on this side of the table to learn, and I've learned a lot about TANF. I'm also in our contracts department, so I learned a lot about the different funding sources. And so to be able to support our communities is something that I'm really excited about. And we too have partnered and got a TA grant to help with our OWF participants. And so it's been a fun ride for me. As you can see, there's been a lot going on. There's a lot to learn, but I'm very excited to share the information that I have today. So Michelle, thank you for having me.
For sure. So I don't want to have this be a round robin. I want to throw a question out and you guys pick it up and you can rip off of each other. So I want to first talk about the topic of leadership, your own leadership and what you've seen in others that really makes a difference. So whoever wants to kind of pick it up and talk a little bit about just what's good leadership? What is it?
I'll start. I think being relatable is very important because we're in a space now where people just want someone that they can trust. And when you think about people that are in poverty areas, there's very limited trust. There's very limited resources. And so when you create a space, because if we're honest, some of the people that we hire, we've pulled them out of poverty and we've helped them, and there's nothing wrong with that. That's how we build our organizations, and that's how we get people that are relatable. So I will say, in order to be an effective leader, I think it's one thing to allow people to understand their part in it, but there's another part of it that means to be relatable.
I would agree. I frequently think of myself or hope that I aspire to be a servant leader. You know, I'm proud to be a civil servant, and I think the work we do is a work of service. So if I'm always showing that I want to be of service and develop leaders who are of service and look towards our participants for what we should be as leaders, I think we can then be very flexible, because I think at this point and juncture in time that you can't be one way. In one room, you have to have one type of leadership dynamic, and in another room, in another. But if you always remember that the participants and their needs are forefront, you find the capacity to be the leader you need when you need to be that leader.
And I'll just build on what Marcy and Lori already said, which were awesome answers and probably would have been my first and second answers. But I think it's really important to have courage. I think that some of the leaders that I've been most frustrated with have been those that I've seen not make the hard decisions, not be willing to confront or address things that need to be addressed. So I think we need to be able to call things out, to bring up the hard topics, to have those hard conversations, and to really kind of model that for our staff, customers, our partners, et cetera. I think without that, we miss a lot.
Anything you want to riff off of on what Patricia or Lori said, Marcy, or Lori, you want to share? Anybody else wants to share?
I can't underline how important what Patricia said is.
Mm-hmm.
You know, I've been around for 33 years, and I know that when people are silent, people go hungry. You have to be courageous. You have to be that person that is stirring things up, making people feel uncomfortable, and you have to be tenacious and make your team that way.
Yeah, I think
I
all
literally
of
got
those
chills.
combined. Yeah, if you combine the three of those, like, you know, being relatable, being that servant leader, because Lori, like that part of it, when people understand that they're being served, it gives a different connotation of I'm giving you, right? I think one of the nicest fast food restaurants I've ever been to is Chick-fil-A. If you've never been, you have to visit. One of the things that they say to you when you greet them is they say, you know, how may I serve you today? And that's not typically what you get from a fast food restaurant. But I think to Lori and Patricia's point, as we make changes and waves in this industry, we can't look at it how we looked at it before. And these people are still people that want to be served. These are people that want to be respected. And so when we keep those leadership hats on and they see those things within us, it can't do anything but exude the leadership, the resiliency, and all of those things within them.
So how has this past 3 years in particular, or since you've been in your post, but in particular these this trying times, what mistakes have you made as a leader? What have you learned as a leader? What has really challenged your leadership style? Love to hear that.
I think for me, the move from being someone who's been very focused on field and community to someone who's trying to change things from the top rather than from the bottom have been the most challenging. When you work in the community, in the field, and with people, you recognize that you don't really have an option to say that you don't have the capacity or this rule is keeping you from something, because you know and understand what your role is, what your why is. And I think as I've moved to try to do the big things that may lend to real change and dynamic change, I find that my partners are not as easily accessible to their why, and not understanding that everything that is delayed, everything that is argued about, every time we focus on something other than the people we serve, you know, we're just failing. And so I think what I wish more than anything else is that I had a button that would speed things up, fast forward, so that I can get people much more invested in the urgency of poverty. And what I also wish is that I could always have participants, both adult and children, around me in these meetings to tell their stories, because maybe I wouldn't need that button because people would see that urgency.
Lori, I'm going to jump in to say, so, you know, have totally feel that, and being understaffed constantly in a way that we haven't been before. So obviously, you know, when you work in our world, you're always doing more than your job description. You're always kind of taking out other things. It has been, I have not experienced it like it's been in particularly the last year. So trying to do just that, kind of like lead from the top and figure out how to do that well, but then also having to do the job of the person under you and maybe the person under them, because those positions are vacant right now. So trying to figure out how to do that and not make a ton of mistakes all the time, because you're going to drop balls, you're going to miss things, you're going to do things that maybe like you wouldn't have done in that way when you were a manager versus when you're an executive. And it's kind of constantly figuring out how to put on a different hat, to look at things in a different way. Also learning what there are times you need to say no. We just cannot possibly take on something else right now. My staff is going to scream at me, or I'm not going to be able to ever have a life outside of work, which has been challenging. But I think just kind of figuring out how to manage all of that with like limited capacity for sure.
Yeah, limited staff has definitely been a challenge. I lost a couple of people to the great R, the resignation one, not the retirement, because that's probably coming soon. And I'll say one of the things that I had to learn to support what Patricia and Lori has said is just realizing what can I do today? As people, sometimes we take on so many things and we're like, oh, I can do it. And you're the worst if you're the parent, and I'm a parent, right? And so as parents, we always think, well, if you just give me one more thing, if it's just small, if it's just this. But I think where I needed to do is create a balance and understand when to say no, because that's very hard for me to say as an executive, not as a parent. I can do that very easily, but just learning the idea of where our roles are and when to say, I'm at my capacity and this is when I'll be able to pick up anything else.
And you know,
And
go ahead.
Marcy, you're just getting photobombed by your child. So.
That's another part of that life.
Sorry, Lori, go ahead.
But you know, I hear that so much. She's beautiful. You're gonna have to tell us her name.
Yeah.
Nadia. All right. Hey, Nadia. Keep supporting your mama.
She absolutely does. Biggest fan.
And you know, when I think about the capacity, though, I know that we've always lacked capacity. It's never really been this way. But I can tell you that in the past, I've had less people. You know, I've had fewer resources. I think that what's happened to the pandemic has actually given us unique opportunities. The problem is there's so many different issues going on. We can't focus on one thing long enough to fix one thing to get to the next. And I feel sometimes like we're running out of time with this unique opportunity because this is the first time that we've had to deal with 7,000 things rather than 700 things.
Yeah. Yep.
Anybody relate to that? You want me to go on to another? I want to pick up. I'll pick it up. Everybody's just like, amen. I do remember I just had a conversation last week with Tara Lamont in Jefferson County, Colorado, and she said, I have 3 jobs right now because of turnover, and I'm not doing any one of them well. So Patricia, what you said was exactly what you felt. So I'm hearing this, and she's phenomenal. You're phenomenal. You just, when you're doing 3 jobs, you're not at your best. I want to talk a little bit about some of these kind of the turbulent times, the changing social and cultural environment, the staff turnover, the conversations, the hard but good conversations around race, equity, and inclusion. What are some strategies or tips that you've learned? What kinds of things are you doing within your organization structurally? And then what have you learned not only as you're doing those kinds of initiatives?
Well, it's so funny. For the first time in 33 years, my department is putting DEI on the table. It's not that we haven't had problems in the past. It's that we're putting it on the table. We've created a team. We're talking about it all the time. And what we find is that so many things are coming up. So much anger is coming up. So much conflict is coming up. And it's happening within our department. And we're always trying to recognize that if we're having these issues, if all these things are affecting us, if the pandemic, what's going on in the world is affecting us, what must it be like for our participants? And sometimes I think that we're so involved in trying to navigate these things ourselves, it's burning up the energy we need to do similar things in the community.
I think in our D&I space, we've taken the approach executively, and we've also had to funnel it down to our participants and our residents. So when we're looking at how a person responds, there's different responses based on cultures. We're in a dynamic of Ohio where we have a bunch of different people, not to say that it's any different from where we were else, but we have a lot of people, and culturally, we have to learn how to communicate with each individual person. And oftentimes we have certain members of staff that can educate us on certain things, but we're still in a space where we need expansion because we do have a lot of Nepali, Somali, just to mention just a few of the communities and the cultures that we're working with. So as we're learning more about just engaging our participants, it speaks to the mental health that Michelle discussed originally and a person feeling safe. If a person doesn't feel safe, good luck. You're not going to get anything out of them, because when they feel safe, they feel smart. And so we're in a space now where we're just working to understand our different cultures, what diversity and inclusion means for all individuals, right? Because this also includes other communities, and just figuring out how can we, I call it a tool belt, so just follow my language, but as we're rebuilding our teams for the individuals that have resigned, how do we build our tool belt so that we can have individuals that can eloquently and smartly say how to deal with these different individuals in different circumstances?
Marcy, I think you're mentioning about, kind of thinking about like a strategy, but at the same time trying to deal with like the things in the now is very much where we are. So during, the last several years, we then formed a DEI council and had like a whole process for people to become involved, and kind of like a charter for what they were going to work on to support the our executive team in doing this work. And then our thought probably have to kind of look at ourselves as an organization before we on implementing this strategy in our TANF and workforce system. And it's just taken so long because of all of the things. So we're in this space of like, it's not happening fast enough for me. We're still having to deal with the day-to-day stuff. Like, what is the DEI Council actually doing? So I think the intentions and the strategies are there, and it's really important, but it's just like, how do we implement this work with patience, like with some expediency? It's hard, and just like, again, we're not always going to be right. I think that like this is something that I don't feel like there is like an answer to.
Mhm. Mhm.
Where do you hope to be in 5 years from now on this issue? That was not on your question list. Sorry about that, you guys. But I really want to ask you this. You can
More
ask.
tools on my
That's a
tool
big
belt.
question.
Yeah,
More
it is a
tools
big
on your
question.
tool belt.
Go ahead, Lori. Go ahead,
It
Lori.
is. It's an important one.
Honestly, you know, given where we are, I would really like to see some real change. Less about the conversations that keep coming up decade after decade after decade, and more about that we're really going to change. I'd love that.
But you'd love to see more action.
Yeah. Lori and Patricia are mashing the gas. I'm with you, ladies, because we do have to get that change. And I would say for me, just aligning that tool belt, right? Just making sure that we do have the people in the space to have the conversations that can support the positions that have been lost. Like for us, I think getting in 5 years, I'm hoping that we can get the youth in this space so that they can have a voice, and we can get other individuals in spaces that may have never thought about being in government or what that looks like, because so many people have their idea of what government looks like, but they don't see everything that we see. So I would say just educating more people, of course, the change. And I think the change is there. It's just moving slower than we want as government workers, right? We tell people hurry up and wait. But I think as we're moving things and we're moving the needle along, it's just making sure that we continue to align people in the space where their voices can be heard, and we're building that true D&I space.
Yeah, and I would echo what the other two just said, but also add, I would like to see this like just be part of our everyday, that it doesn't have to be like an initiative that we are like, this is just, it's part of the conversation naturally. It's just something that is always considered, not something that we have to like start a new thing in order to get movement and, you know, results and tools, etc.
I'm glad I followed my instincts and asked you guys that. I want to pivot because I loved all your responses, and it's what everybody's thinking about. I want to pivot. One of the big questions whenever I've done like presentations or conferences or stuff like that, whatever, ultimately anybody, like people raise, well, but what about the WPR? What about the WPR? I know each one of your programs. I know how you guys feel about that. You guys are different in some ways. So what advice, first of all, share with other people what you're doing around this issue of engagement and the WPR more broadly. And then what advice do you have for programs that are kind of, stuck in that WPR land world?
So I'm really proud of what we've done in Louisiana, because if anybody looks at our stats, WPR isn't really great in Louisiana. And we could talk for hours and hours about why it is. But I think we've made a big commitment to not just looking at increasing our WPR rate, but about why it's low, like for real, and what we want to do differently and what message we want to give. Because I don't want, and I know my staff doesn't want, our participants to just mark off a checklist that they're doing something for 10 years. If we're going to really lift them out of poverty, we have to explain to people that in order to make that 1 hour of sitting at that desk, at that place that finally gives you a chance, it took maybe 2 years to get you the capacities to do that 1 hour. And one of the things I think we've done really well in Louisiana is we've changed our model of engagement with our participants. We're working with them in a more respectful way as partners, rather than just telling them what to do, asking them. And I think we've also done a really great job in terms of empowering our staff. My frontline staff have done some incredibly innovative things. We've contracted with Agilify in state office to develop Lean Six Sigma practices. So that's a fancy word to say, you all don't know how to structure anything, so we're paying you millions and millions of dollars to teach you how to structure things. And so we've involved not just our state office staff, but our frontline staff. And I have a frontline coach that just promoted to supervision, who's doing a project on work participation rate and the barriers, and including our participants in that work to identify it. It's going to be probably a years-long project, but just the idea that my step coaches are doing this and they're engaging our participants. I have another wonderful coach that created basically a community resource fair that bought all of her participants, all of the people on her caseload, if they attended, they got a participation hour, but they also got lots of other things. They had the opportunity to get a vaccination and went up to $200, and one did win. They got diapers. They got to connect with community resources. They got to connect with people who might be able to help them in other arenas. And I think that the more we listen to the field and the participants, and the more we empower them to not just look at the rules and regulations, we can work on that. Start looking at people and what they need, and then we can meet in the middle. And we also have another project where we're working with the Blanco Center, a university here, that are helping us look at our policies and see what low-hanging fruit in our policies that can get us all motivated within DCFS to stop looking at that checklist and moving our work towards really developing our participants.
So from our perspective in Philly, we, I would kind of like take like an opposite look than what you, or have taken like an opposite view, Lori, than you, in that we've kind of pushed on the state to say, hey, there's a lot more flexibility with this than you all are giving us, and have been really big proponents of advocating for that. And there's been in the last year and a half or so a new bureau director for us at the state level. So we are finally seeing some flexibility with some pieces that, you know, we've known for a long time probably could have been more flexible. So things like the timesheets for training programs that, you know, we've had to have people sign off on versus someone telling us, yes, I went to class for 12 hours last week. So things like that, you know, we were seeing a change in our manual that came out for this fiscal year. We've seen more flexibility around how much time folks can spend in job search, you know, versus kind of having to switch back and forth to other activities. So pieces that we've known there was some room for flexibility. We just pushed hard and, you know, helped partners push hard against the state to, you know, really get us to a place. Is it perfect yet? No. But do I think that the changes that they made in the new manual are going to help us to be able to serve customers in the way that Lori just talked about? Yeah, absolutely. And get our staff off of that checklist, that like kind of timesheet stalking mode that we end up having to be in because of all of the burdensome requirements that are put on our programs.
And I'm so envious of you hearing that. You know, one of the things I started out with in Louisiana was really trying to do more of those things. And, you know, Louisiana is a different kind of state. We're a wonderful state. And I think it's just that these ideas are really new. So we're trying to figure out, let's get the success where we can get it. And then, but never forgetting that we should be doing what you mentioned, Patricia.
For us, we work to put the human back in human services and just let people be human. So if people, and we've had the pleasure, small plug, but we've worked with Mathematica, and John McKay and his team have been amazing with just simplifying things for us. So one of the things that they did is they created like a couple of pager for us, like our orientation packet, but it's like, okay, I have to do these X amount of hours, and they just simplified it. And so we're in a space now where if we just help people understand the simplicity of what WPR is and what that means, and to align it with their life, because some people, oftentimes when they think about that space, they think about people taking away their life. And one of the things that I appreciate about our AMP, aka CCMEP program, is we allow people to still have their life. So you can still drop your kids off at the STIT, you can still do X, Y, and Z and still complete your hours with the idea that you've given us an individual plan when you started this program. So we have an idea where you want to be. So instead of forcing you to just go somewhere to do something, it is us saying, okay, you told us that this is what you like, this is where you want to be, and we're going to help you tailor your life around it. So it's just making sure that we're helping people meet their goals, because if we help them meet their goals, then they will continue to help us meet ours.
So as a follow-up question to that, what we hear oftentimes is leaders like you guys say, do what's right for the client. We're caring about flexibility. We want that. But then the messaging to direct service staff is, got to meet the WPR because that's what they're measured by. To what extent, well, first question is, how have you messaged that to your staff, that kind of flexibility? And then are you still, to what extent are you allowing flexibility in how their performance is measured in relationship to client engagement and the WPR? Those are two different things. Thoughts around that?
So those are some real things that I'm very proud of in Louisiana. I was very fortunate that when I moved into this position, our TANF program was being administered through the Workforce Commission, and we assumed it again within DCFS. So I literally could do a reset button, hire all new staff, hire all new leaders, and start from the very beginning. From the very beginning, I told them, you let me and the program managers worry about the work participation rate, and your job is to engage participants and work with them on creating trusting relationships. Of course, we brought Mathematica in, and we've really focused on getting our staff involved with learning the goal forward method and really living it as a type of work. So that's number one. Number two, what we recognize very clearly is just because workforce, our TANF program feels that way, doesn't mean that the rest of DCFS and the rest of the people that they're co-housed with feel the same way. So when they come to us and talk about, we had people even tell my staff that, what they were doing was illegal and unethical by just worrying about engaging them and not making sure they did these things. I had the economic stability director, I was speaking about some of the work we were doing with a federal partner, and she basically told me that she was embarrassed to be in the room that I could speak that way about workforce participation rate with a federal partner. So really what we've been doing is we've been having retreats and meetings with our internal stakeholders, showing them what we're doing and showing the progress that we're making. One of the reasons I assumed TANF was I knew that it was going to be a bridge between what we were doing in workforce and what the rest of the department was doing. So we've got them working with Mathematica. I'm working with the TANF director about the kinds of contracts we're making and the kind of messages we're making. And we're able to use some of the platforms when we're speaking to legislators, judges, to try to let people know that if we engage and empower, workforce participation will increase. But we've got a lot of work to do first. And I think it's a constant battle. And when the snakes rear their heads up, we have to take our swords and our mallets and beat it down.
Other comments from either of you?
I would just add, we haven't measured via WPR since I've been at Philadelphia Works, but the staff still does it to themselves. So I think that is like some of the hardest part is undoing some of that. Staff have been in the organizations for however decades, they're so used to that being the thing. So even though hasn't been in their contracts in at least 6 years, it's still a thing that that staff hold themselves to. So we have been working to figure out what are some better kinds of goals we can put into the contract. So we're looking for our new contracts that start in October at things like progress in their IEP, their individual employment plan, things like that, and just ensuring we can measure these things. But we've been trying to get creative around what kinds of measures we can put in that won't push the staff into doing things that are like these really strict, numbers based, kind of goals.
And we've been doing some similar things. Every year we give performance planners, which is what you're going to accomplish in the next year. And we also rate our staff. So one of the things we're being very mindful of is that we're including not just the checklist things, but, innovations and goal forward model implementation, mentorship. We're including those things in what our expectations are so that they just don't have one measurement, they have 25. And we want to give the measurements where everyone can be successful. All of our staff have certain talents. We want to make sure that we measure and congratulate every talent.
I think something that's been very helpful for us in Ohio is our senior leadership has really supported us in the concept of changing what this looks like. And of course, our CCMEP program was a part of that. And then you have our deputy county administrators and then our commissioners that are saying, these are still people. At the end of the day, these are residents. And if we give them the resources, then they have the opportunity to figure out what they want to do with the resources. And to support Lori and Patricia, like we do have those people that are like, but we got to meet the number. And I'm very, with us, we're just like, if we help these people, the number will come. If you just focus on getting everyone the services that they need, treating them like human beings, letting them know when they make mistakes and still getting them back on track, the numbers will come.
Mm-hmm.
So I want to just pause and see if there's any questions on the Q&A. Last I looked, there wasn't, but invite the participants on the people on the call to go ahead on this webinar to go ahead and put any questions that you might have in the chat or the Q&A box. So go ahead and do that, or comments that you might have as well. Akash, do we have any questions?
Looks like we have one question in the chat already, so I can go ahead and say it. And so as leaders, what steps have you taken to filter the flexibilities to the front lines? Are front lines still measured by meeting the WPR, or have they been tailored to a more client-centered set of measures?
I got that one, Akash, and asked it just in a different way.
Fair enough.
So how's that? Thanks so much, Akash. It's okay.
I'll be on the lookout for
That's
other
okay.
questions.
Anything else? That's okay. Anything else, Akash? Yep, submit your questions. Thanks, Regina. All right, while they're submitting their questions, I had this great question, and then, oh, I know what it is. I almost forgot it. So I'm just curious, and again, I apologize, this wasn't on my list of questions I had for you guys that I sent to you, so I'm putting you on the spot. If you could wave the magic wand on the federal side or in the state side or both, what changes, what resources, what would you feel like you need that could just bump your success up even 10%? Like when I say success, really helping families get out of poverty. What changes, or could the federal government or state government or resources do you think would make the difference to really just take it up a notch?
I had a great experience at APHSA in which they brought together the partners from the federal partners from SNAP-E&T, from housing, from workforce, and the federal partners were so clear that we're supposed to be flexible. We're supposed to work together. We're supposed to be innovators. And I'd give anything if we could have some way to float that message that I felt very clearly in that room to all my partners in Louisiana, that no matter what you think the regulations are, no matter what you think the barriers are, the truth of the matter is we're supposed to be building people up to reduce poverty. And that is your number one goal. Do that, follow that North Star. Anytime you deviate, you know, there's a problem.
So what I'm hearing you say is infuse Lori's heart and brain into all the leaders in Louisiana.
Or at least tell them to not be afraid. You know, I say more than that, that every time we talk about things, people say, oh, we'd love to do it, but this rule says no, and this rule says no, it says this. I always look for what the rules say we, you know, don't give us guidance for, which means we can be innovative. But I think for some unknown reason that there's not enough listening to what it clearly seems to me our federal partners want us to do.
Thank you, Lori. Others?
I think that the administrative burdens, if we were able to worry less about tracking every single little thing, I just think that it has become so ingrained in the direct service staff that it really, no matter what we do, it's like constantly having to unteach that and remind them that like we've gotten more flexible around this. We don't have to do that. Like, why is this form coming back into existence? We got rid of this form. If there was a way to do that so that, you know, the federal government and state governments felt like, you know, we were still doing things in a way that was in line with you know, all the regs, that would be my magic wand wish.
Amen. Like, trust us, trust our participants.
Yeah.
My magic wand is completely different than Lori and Patricia's. And I think my magic wand, as I think about my education hat, is just figuring out when we're working with our younger residents. So when we're in our schools, what message are we giving our kids, right? When we have children that are in poverty, you have some that get out, but you have some that don't. So I think that if we're looking at the underlying message and really figuring out like potential ways to eradicate poverty, we look at what can we do for those children and those young adults. And even with us, we do have a learning, earning, and parenting program, which is called LEAP. And I'll give our state kudos for thinking ahead, because one of the things that they do in the LEAP program is they've actually dedicated our facilities, like they have child care centers that are just for young adults that have had children, right? No other children, no other parents are in there. It's just for them to have for those young adults. But then it's also making sure that they're going to school, making sure that they have child care, making sure that they have all of their needs met so that they can be successful, and then understand you made a mistake. This is the first one you're going to make. There's going to be plenty more in life, but let's figure out how we can help you overcome that hurdle. So I would say just educating our young adults in a space so that they don't feel so self-defeated. Because once we get to, and if we think about a lot of our programs, once people get to the age of like 35, 40, I'm not saying we give up on them, but how many programs do we have for youth that are in that age range? So it's just looking at how can we really move the needle with our young adults so that we can make it so that we don't have to abandon our 35 to 40-year-olds because we've already set them up for success at an early age.
All right, we have a couple of questions in the chat, super important, and then I want to have one wrap-up question. So we're going to do this speed round. So timesheet signatures are a big challenge. Ida Emerson, timesheet challenges are a big challenge for us. Could you elaborate more about what you guys are doing? Let's take one. So is somebody doing something amazing around timesheets?
I mean, we're trying to implement TUAPath, which we're hoping will help. You know, part of it is
online.
Yeah.
Online. Okay, sorry, Patricia.
We're getting leeway from the state on it, which is our
leeway from the state. So Ida, reach out to Project Improve too. I can help you answer that too and tell you what other states are doing as well. My friend Kim Klum, how have you seen improvements or challenges to participant engagements with shift to virtual services? The virtual versus like hybrid, what are you keeping hybrid? What's working virtually? What are you gonna go back to in-person around? I totally failed to mention that one deeply, but you guys, it's great conversations.
Just really quickly, we kind of cater it to the person with the idea that
Okay.
if if we got to work to get you childcare and you don't have childcare yet, then your activities, we figure out how to work around it. So it's really, we're back in person, we're all in, but there are those one-offs where individuals are kind of having that challenge. So we just cater it to the person.
All right, more to come on this topic. I want to give everybody, and do you have anything to add that's working really well, Patricia or Lori, that's working really well virtually?
The one thing I would say is we developed a learning management system. So we've got a lot of online content that was not available before. That's job search, job readiness, and we got some gifts from corporations that helped in that. So that piece has been awesome for folks that can access it. I will add that.
We really should highlight that, because that would be a great additional webinar, Patricia. And I think we could loop back around to you and get more information about that, because I think programs are really struggling with this right now.
I'd love it.
Lori, anything to add?
I think just the fact that we recognize we do have options. Like if we can't do it in person, that shouldn't stop us. We know how to do it virtually now. So, and vice versa. Don't let your virtual processes keep you from making physical contact when you need to and when you can.
Michelle, looks like we have one more question.
I saw that one, but we've got 4 minutes, and I just want to pop this one in, and we can get back to that person, offline. Actually, it says anonymous attendee, so we can't get back to that person. Sorry about that. You can reach out to Project Improve and get that. We've got our logo on there. What advice do you have for everybody? What advice as a leader in leading through challenging times, quickly in 1 minute or less, each of you? What advice?
My biggest advice is just stay with it. Like you're here for a reason. You wouldn't be on this webinar if you weren't someone that cared about this. We need leaders like this in this field. We need people who are willing to stick through these really, really challenging times and rely on your peers. Reach out to your friends in other areas, and keep those networks going to keep your motivation up.
I would say always remember to be an agent of change, and every day look around to the people in your group to develop those future leaders and agents of change and mentor them and model so that we never stop the change and we never stop trying.
I'll say
Amen,
take your
Lori.
own advice. Take your own advice and continue to share with every individual that you can. Happiness is infectious just like anything else. So if you continue to take the advice that we give to our participants, if we continue to do inner workings within ourselves, we'll definitely make our communities a better place.
You guys, I just want to thank you. I know each one of you, you're amazing, amazing people and amazing leaders. So grateful for your just sharing your expertise and sharing your wisdom with us today. Fabulous job. And we just wanted, for those of you who are listening in, again, as a reminder, we have another webinar next month. And we can put that, Akash, if you could put that in the chat, the date, the time, same time actually. It's the third Thursday of the month. Can't remember the date exactly. And then we've got the leadership initiative, the Improve Leadership Initiative, play on words there, intentional. Improve Leadership Initiative starting in the fall. So thank you so much. Damon, do you want to say any last words?
Just really quickly, thank you to our presenters. I've been taking down furious notes. So looking forward to August 25th. Thank you, Michelle. Thank you, Sujina and Akash, and definitely Lori, Marcy, and Patricia. We'll have to talk more about how we can use you some more for other TANF webinars and discussions. But thank you on behalf of the Office of Family Assistance.
Thank you,
Thanks, everybody.
Thank you.